Welcome back to MedBites. We're going to go over the aortic arch. It's extremely important for your anatomy and embryology classes, and sometimes it gets used in pathology. So let's get to it. The aortic arch has three branches. This is the first one, the second one, and the third one. The first one is the brachiocephalic, and this is also known as bovine. It gets used sometimes. Just remember B is for B. The brachiocephalic has two other branches. One is the right subclavian, and the other is the right carotid or common carotid. And it's important for you guys to know that the right common carotid supplies what? The head and the neck, the right side of the head and neck. The second is the left common carotid, which is just like the right one, left side of the left head and neck. And the third one, the third branch, is the left subclavian. Done. That's all you gotta know. Now, embryology is really important here. You gotta know that aortic arch comes from the pharyngeal arch arteries. You gotta know that the third arch leads to development of the carotids. A quick way to remember this is that C is the third letter of the alphabet. Done. The fourth arch leads to the formation of aortic arch on the left and subclavian on the right. And the sixth arch results in the formation of the pulmonary arteries and the ductus arteriosus. This is by far the most important thing that you guys got to know because it gets tied into patent ductus arteriosus. So how the question would present itself, the hardest question that you could possibly get for this sixth arch specifically would be that they would give you a scenario of a baby that becomes cyanotic when feeding. And then they would ask you what is the root cause, like which arch derivative does the problem come from. So the moment they say cyanotic when feeding, you got to know that this is patent ductus arteriosus. So if this is the right ventricle, this is the left ventricle, this is the pulmonary artery, this is the aorta, and this is the pulmonary artery. Here is the ductus arteriosus. Now, normally when the child is born, this needs to be closed. We give in the medicine to close it if it doesn't. But if it stays open, it's patent ductus arteriosus. And when the child is feeding, there's elevated pressure on the on the right side, which results in deoxygenated blood going to the aorta. And that's why the child is cyanotic. Now, the question will then ask you, which aortic arch does this problem arise from? And that's when you got to know that, this is patent ductus arteriosus. And the problem with ductus arteriosus is that the problem arises from where? The sixth pharyngeal arch. And that's it.